Ms. McDonald, would you please call the roll?
Mayor Slanka?
Here.
Mr. Richmond?
Here.
Ms. Cash?
Here.
Ms. Sipsey?
Here.
Ms. Miller?
Here.
Ms. Lawley?
Here.
Mr. Bonnell? Dr. Zollett?
Here.
And do we need to excuse any members?
Mr. Bonnell?
Mr. Burnell, oh, okay, so is there a motion to excuse Mr. Burnell from meeting today?
So moved.
Is there a second?
Second.
Okay, Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Yes.
Ms. Sipsey?
Yes.
Ms. Miller?
Yes.
Ms. Lawley?
Yes.
Dr. Zollett?
Here.
Thank you. Next item on the agenda is citizen comments. And do we have any today? Hearing none, we'll move on to the next item. Next item is approval of the minutes from March 2024. Is there any, or do we have a motion to approve the minutes?
So moved.
Is there a second, please?
Second.
And is there any discussion regarding the minutes? Okay, hearing none, we move to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Here.
Ms. Sipsey?
Yes.
Ms. Miller?
Yes.
Ms. Lawley?
Yes.
Dr. Zollett?
Here. Yes.
7:31. Okay, the next item on the agenda is to receive and file a financial report from March 2024.
I need to report, and Carla, I think this is correct, so you have to correct me, but this is the report. Still, all revenue has not been placed in this report yet. And I said, I checked with the finance director and said, are we gonna be a month behind, with this report? Cause, I'm reporting to the board every month. And she said, no, they should be catching up. So when it is a full report, we'll discuss that, but the new system really, we were told was supposed to, when you receive checks and when you expensed your budget, it should be in real time, so that's what we're hoping to have. So this is what the report will look like, but it is not all of our revenue in here. So,
Is there a motion to receive and file a report?
again, very early in this stage, and we have a lot of reimbursement that comes in, so it's no concern about the budget at all.
Okay, is there a motion to receive and file?
So moved.
Is there a second?
Second.
Thank you. Is there any discussion? I did have a question. Looking at the financial notes, the first page. Yes, right there.
Uh-huh.
The indigent services,
Mhm.
it looks like by March we've spent nearly half of what we have for the year.
Yes.
So what
Yeah.
does that mean for us?
This budget is managed by the health department, but the monies come out of the general fund, so it does not come out of our budget, which is a good thing. And it just seems like everybody is just getting indigents. We've seen just a lot more people. And for some reason, we're the most lenient city in the tri-state area. So until we find a way, or the state finds a way to define indigent services differently, we're just gonna probably just keep having indigent burials. These individuals just do not have insurance, and the families are just not paying for them. Most of the families that we see are they either do not come forward to claim the body, and so it's friends claiming the body, and or they're estranged, and or they're in the same boat that they're in, and so it's just.
Is there, so basically if we reach our budget by
Yeah.
August or September, but we still need.
Sam will
funds.
just reappropriate more money
Okay.
to cover the budget.
And I was also wondering was there like an uptick or something like that in the winter months, or like how that might work?
Amanda, I don't think so, is it? It's just.
Yeah, it's been pretty consistent.
Okay.
There's just a lot.
It's just
Mhm.
normal?
Yeah.
Okay, all right, thank you. Is there any more discussion? All right, hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Yes.
Ms. Sipsey?
Yes.
Ms. Miller?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Dr. Zollett?
Yes.
Thank you, the motion passes, thank you very much. The next item on the agenda is our education presentation. Mr. Genowine, I'm talking to Dr. Genowine, excuse me.
Mr. Doctor.
So usually I try to kind of do this tied into something current that's going on. There's a little bit of a measles outbreak throughout the United States, but we covered measles. We had some meningitis up at Miami, we covered meningitis. So April happens to be Parkinson's Awareness Month, so I kind of went with this one. So Parkinson's disease, to kind of read off a little bit of this, but a progressive neurodegenerative disorder. So progressive meaning it continues to get worse. Once you develop it, it's a progressive disease, so it continues to get worse as time goes on. Neurodegenerative means it affects the neurons in the brain and degenerates them, destroys them essentially. It particularly affects the basal ganglia, which is a thin layer in the center of the brain that produces dopamine, and so you get a loss of dopamine, which is a big part of its manifestation. There's no good test for it. Can't do a blood test, can't do, we'll get into a little bit, and can't do imaging that proves it. It's mostly a diagnosis of symptoms, making sure there's nothing else going on and seeing that they fit the typical pattern of symptoms, which is a tremor, bradykinesia, which is kind of slowness of movement, rigidity, their muscles become rigid, something called cogwheeling, oftentimes you can elicit, and then postural instability. So their balance and their gait becomes very unsteady. The tremor, in particular, is what's called a pill roll tremor. So a lot of you have family members who have a resting tremor, which is, or a intention tremor it's called, which is when they go to do something, they're shaking. When they eat or they drink, they're shaking. That's what's called an intention tremor, a familial tremor. Old days used to call it a senile tremor because it tended to be more noticeable as you got older. That is pretty much a benign.
I was just gonna say, we called it an essential tremor.
Essential tremor is another name for it.
I just.
There's numerous names for the benign one. And it does get annoying and aggravating, but it's completely different from the Parkinson's tremor. The Parkinson's tremor is at rest. So you look over and they're sitting watching TV, and it's called a pill rolling, where they almost have the old days again, they described it as a pill in between their thumb and their forefinger, and they're just rolling that pill. And they sit there and they don't even know they're doing it. And so that's the most kind of classic characteristic tremor. It can look like a lot of different things. But the pill rolling tremor, which differentiates from the essential tremor, which is much more common, but is essentially a benign process. The bradykinesia, again, is just they're slow to do anything. When they walk, when they go, everything's just kind of in slow motion. The rigidity, the classic example is taking the elbow and kind of, normally if you pull your elbow down, theirs will do kind of a cogwheel approach because the muscle is so rigid. And then again, typically as a little bit later stage, they get a shuffling gait, a lot of falls, imbalance, and a poor gait. It affects about 1% of people over the age of 60. That increases to about 4% over the age of 80. James Parkinson in 1817 was the first who described those 4 symptoms all together and the fact that they were progressive in nature. And he was born on April 11th, so that's why April is Parkinson's Awareness Month. And there's no identifiable cause. There does seem to be a very small genetic link, but usually it's pretty predominant. So dad had it, uncle had it, aunt had it, sister has it, and then you might be at a slightly increased risk of having something genetic. They have found some genes that seem to be tied to it, but nothing definitive. And repeated head trauma. Very rare, but Muhammad Ali is the classic example. Not all boxers get it, so it's not everybody. There must be some kind of predisposition, but repeated head trauma is definitely linked to increasing your odds of getting Parkinson's. So the symptoms kind of reiterating here again. My example got cut off there, unfortunately. Cleveland Clinic had a nice example of, again, kind of showing the slow movements, the tremor while at rest. Again, is kind of the key there. Blinking is another one. They tend to just kind of be more frozen-faced, so they don't blink as often as you or I. Their affect seems kind of flat in the face, but it's the rigidity, the gait disorder. Eventually, as it gets later into the disease process, they do get a cognitive issue, so they start to get forgetful, sometimes similar to other dementias, and even psychosis, so they can get hallucinations and other psychotic features. Again, the cause and risk factors, not a lot is understood. There does seem to be a slight genetic component to it. Environmental triggers is another one. There's a couple chemicals that have been associated with it if you've had a lot of exposure during a work career or something like that, but they really have gone out of use since about the 1970s and 80s. Male does increase your risk, and obviously age increases your risk. So the diagnosis, again, pretty much comes down to all history and physical. When did what start? What symptoms are they noticing? Oftentimes it's family who's noticing their particularly the slow movements. The patient themselves don't even necessarily realize they've slowed down over the last couple of years. And then doing a physical exam, kind of looking for some of those same components. Imaging has really not been useful. CT looks essentially normal. The MRI, you can do some specific things in specific centers. Again, my image is cut off there, but the part of the brain you're looking at is just a fine layer right in the center of the brain that's pretty hard to delineate on either kind of imaging. So there's no good classic test. One of the articles I was reading said that actually neurologists have about a 80% correct diagnosis at autopsy. You can find the definitive diagnosis, but neurologists with those 4 symptoms and the progressive nature get about an 80% success rate at first diagnosis, just with history and physical. Treatment, there are medications that can help. So levodopa was the original one, or the earliest ones. The ideal goal would be is if we could just give them dopamine. Well, when you take dopamine, it doesn't cross the blood-brain barrier, so you can't get dopamine from your stomach to your brain. So they stepped it back one to a precursor called levodopa. Levodopa does cross the blood-brain barrier, but only about 5 to 10% of it. So you had to give fairly big doses to get reasonable amounts, and then it would be converted in the brain into dopamine. The problem was there was a lot of side effects from it systemically because you were giving pretty high doses. So a lot of GI issues that came with those doses. And then as people stayed on it, they realized even then that people had this kind of intermittent, remitting, relapsing symptoms, that they'd get better and do great, and then for whatever reason, the brain would kind of become resistant to it, and they'd relapse almost worse than they started out, and they'd stop the drug, they'd restart it, they'd do better. So there were a lot of problems with it, but it kind of led them in a direction. They then added carbidopa to that, which improved the transmission across the blood-brain barrier, allowed lower doses, and did away with a lot of the side effects. So it's much better tolerated. They have a combination pill now that does both of those in one. Pretty much the mainstay for treatment, Cinemet. Dopamine agonists, those block the destruction of dopamine in the brain. They do cross the blood-brain barrier, but they're not as effective as the levodopa-carbidopa combination. So they're used early on when patients first start showing symptoms and physician thinks they may have Parkinson's. You'll start with a dopamine agonist because they're extremely well tolerated compared to the other ones. And they are fairly effective for mild disease. Surgery, you can do, the neurosurgeons can implant a deep brain stimulator, which is a tiny little wire and electrode in the center of the brain in the area needed, and then the wire runs down to a battery in the chest, and it's basically stimulating that area. Does quite a bit of improvement in the tremor in particular, but even some of the slow movement and rigidity improves with the deep brain stimulator. Again, it's a bridge. The disease itself will eventually overcome it, but it gives pretty good quality of life to people who have severe disease. But it's pretty basic, obviously. And then therapy, physical therapy, occupational therapy, speech therapy. Speech is oftentimes effective. In that diagram, it mentioned swallowing, the muscle of the esophagus, but also in speech patterns. Speech oftentimes gets very slow and very soft. So speech therapy becomes a big one. Physical therapy is huge for trying to keep strength up, keep balance up, showing them tricks to overcome the shuffling gait. And again, the shuffling gait is just very small steps that they hardly get their feet off the ground, and so as a result, they're oftentimes stubbing that toe on the carpet or anything, and then with the poor balance, the frequent falls is a problem. So PT, OT, and speech therapy are huge for ongoing treatment. Prevention. Normally I kind of like to end my topics with, how can you avoid it? That's how you can prevent it. Pretty much nothing. We don't understand it, so we don't know how to prevent it. There are some studies out there saying a cup of coffee a day, caffeine, may have some improvement in symptom, reduction in onset.
What about wine? What about wine at night?
That's right, caffeine in the morning.
Why helps an essential tremor, I'll tell you.
Caffeine will aggravate the central tremor and alcohol will improve it.
Right.
So that it'll help you diagnose, you know, which one you have if you think you have a tremor. But healthy lifestyle, exercise, again, maybe helps reduce it. There are some weak studies on that too, but ultimately, it's a tough one because we just don't know a lot about it, and therefore how to prevent it.
Does it progressively get worse and worse as
Yes.
you get older? I mean, it does
Oh, yeah,
never, you
yes.
never get to
Yeah.
the,
No.
oh, it just gets,
No,
okay.
it will, it is
Okay. I was just
life
wondering.
ending in its progression, yeah.
Okay, cause I was just wondering if you get to that point and then you stay, but, so Michael J. Fox
Yeah, but he should have
has
been
a
dead.
different type of.
Yeah,
or
he's
just-
he's been,
He's one
to
out
my
of-
knowledge, he's been a pretty miracle patient.
Okay,
But again, I think, you know, he can afford
everything,
the most of everything, and I'm sure he has a deep brain stimulator, and,
okay.
you know, he's probably on multiple trials of experimental medications, and, yeah, he's a unique case.
Yeah, 'cause I was just wondering, do you get to the worst part and then you can just coast out forever, or you
No.
just constantly get?
He's also unique in how young he was,
Right,
you know.
right. Isn't he about 20 years probably or
Oh,
more?
longer, I
Yeah,
think.
He was in his
Yeah.
20s.
Yeah, so
think
I know it was been a
longer.
long time since we, yeah.
He was in his 20s when he was diagnosed.
Yeah, longer.
And he's
Yeah.
50-something now, I think.
Mhm.
With the brain injuries, the head trauma,
Yes.
is that always physical, or can there be like a mental aspect of it? Like if somebody's having a lot of, episodes or really high intense,
I don't think so.
not.
No, I think it's purely
Physical.
traumatic, yeah. Concussion, repeated severe concussions.
Well, thank you, Dr. Genowine. Next item on the agenda is new business. And Ms. Jackie, our health commissioner, will start.
Yes. I will start. This is that time of year, it's our spring conference, and it's in Columbus. We always have a spring and a fall conference, and this one is exciting because, Middletown Connect is presenting at it. On page 6 of the brochure, I don't know if it, maybe she didn't put it all in here, but I'll show you. We're presenting because that was a Ohio Department of Health grant, as well as they always call for, the spring conference is called a combined conference because it's heavy on nursing directors and environmental directors, so all of the combined disciplines, whereas the fall conference is usually the health commissioner and medical directors conference. And so they like to see any projects that people are doing around the state, and we've been invited, so we will, that was on the last day, Carla's coming up on the last day, and I'll be going the Monday, Tuesday, and then the Wednesday, day for it. So we're excited there. Yes, I think that's the only travel, is that this month, right? The two of us.
Okay. Fantastic, so the next item is the,
Yeah,
oh,
we'll just
sorry.
look at- Yes. Mhm.
May I have a motion to approve the travel authorization?
So moved.
May I please have a second?
Second.
Thank you, it's been approved and seconded. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Yes.
Ms. Sipsey?
Yes.
Ms. Miller?
Yes.
Ms. Lawler?
Yes.
Mr. Bonnell?
Yes.
Dr. Zoller?
Yes.
Okay, next item is a form update.
Yes, this is the NAF form, and the form is called NAF for name, address, phone, health history. This form is filled out every year for the board, just to make sure we have your current information, to make sure that we have, like if you have any change in your household, if you've had a baby, or if siblings are in your household, or children move back in your household. So this form is an emergency preparedness form if we needed to prophylax our board, we would know how many and who, so we keep count of this. This kind of happened when we were doing anthrax, when we needed to know how much Cipri and Doxy to keep on hand, Cipro and Doxy to keep on hand, so that if we start having bioterrorism happen, the board is always protected first. And so we know how much medication to bring in. So this is given to the Board of Health, we also give it to City Council, and we give it to our fire, police, and our department heads. if they so choose to turn it back in. It's just given in the count so that we can make sure we have enough medication, whatever medication is needed, for. We don't really harass people if they do not wanna give us the information. Some, people think it's invasive information, but it really is just, you can put your age down there, but it's just for medication, so we just need to know, like if it's children, we would need to know how much they weigh, because we need to, kind of make sure that we have the right dose for kids too. So this just needs to be turned in, Chandra, now your hand.
I was
up,
gonna,
so-
I was gonna say, if you can fill it out and leave it today, that'd be great. If not, bring it back with you at the next board meeting and I'll put it in a file and we'll keep it.
And if anybody needs extra forms, we can provide it for you too. So, yes.
And it doesn't go anywhere, it just lives with me.
Have there been changes to it, or are we just updating our files?
I think we always update it every year, but I think I don't think it's any changes. If you look online, this is Ohio's. So every health department, everybody that fills out a NAP form looks exactly like this, but, no.
Yeah,
we
there's
just
no
do it
change to
every
the form, it's just people move, people's phone numbers change, people move in and out of the house, so.
All right.
I always let people suffer with me. I remind people I have 5 people in my household and 4 of them under 18, so I'll have to change my form. Or maybe not, before emergency, they might be out, so anyway. But I always let people suffer along with me. So let me know if you need any of these extra forms,
All right.
if that's what the NAP form is.
Is there any action for that?
Mhm. No action for it, no.
All right, so the third item is our first quarter report.
The first quarter report is just always given to you with, I'm trying to look here, 24. Yeah. But this is the first quarter, so this is January, February, and March, yeah.
I had a
Did we
question.
put the other one in there, Amanda? Oh, yeah, and then,
23.
For 23.
yeah,
It's behind that.
behind this one?
Yeah, behind the customer survey results.
Oh, this one, okay. And it's, yeah, thank you. And we always try to put that one in there too, just to compare it to, okay. So, yeah.
I had a question about that actually with the.
It is.
With the retail food establishment inspections,
Mhm.
it looks like February is always pretty low. Is there a particular reason for that, for February? Cause it goes from like 13 to 2, then 11, and then last year it was like 8 to 2 to 33.
That's the, we should be finishing up our inspections,
Gotcha,
so
so
that's, yeah. We
Drop
want it
some.
low in February. Yeah, we want everything to be done by the end of February, so that's
Gotcha.
why. And just to mention, because we're training, I have 2 SITs, our numbers are kind of low, cause we're spending a lot of time with the training. I'm going out with, Brandy and Sarah, so our numbers they're gonna be pushed back, because we're taking the time to train in different areas.
So that's compared to last year.
Yeah,
Yeah.
compared to last year, yeah.
Good to know, thank you. And with the customer satisfaction survey, looks like there was only 1 return in the entire first quarter, is that correct?
Yeah, and we push those. We do. We push those at the window and,
They just like, nah.
we just had one filled out. But they were highly satisfied.
They were, it was, good job. Yeah, I guess that's basically the only place we could say, here, would you please fill this out, or do we have like a sign or anything, or where else could we ask people to do the survey?
When we had clinics,
Mhm.
we did surveys then. When we were at the, farmer's market, we had surveys in last fall.
Okay.
I mean, last summer, remember
Right.
the farmer's markets?
Mhm.
We do
So
outreach.
anytime we go out,
Yeah.
we'll push the paper copies.
Mhm. And it's been winter, so there we go, it'll probably increase in the summer months again. Okay, thank you. Let's see, are there any more questions or any more discussion?
And that doesn't have it, we don't need approval on that.
I was just looking at some of the numbers.
Mhm.
Looks like.
Oh, I'm sorry,
Oh, that's okay.
it's in the board.
Yeah, looks like hepatitis C is a bit up. Any particular reasons or that we know about for hep C going up a little bit?
I apologize, we go into my report?
Oh, shall we move on? Okay.
No, she
No.
was just wondering, she was looking at the, quarterly
Okay,
report, and it
okay.
looked like hepatitis C was increasing.
It's a bit, yeah.
Yeah.
And
You know, most of these, move up and down throughout months. Hepatitis C has definitely been, a problem, a rising problem over the last several years with the, drug epidemic. It's transmitted typically with IV drug use, so, it has been an ever increasing problem, along with HIV, and syphilis isn't IV drug, but it's related to the, opioid epidemic. So those three in particular have had their ups and downs throughout all of this, and kind of steadily rising as those numbers rise.
With hepatitis C, what are other ways that people can contract that? Is it only through intravenous, or are there other ways as well?
You in certain much more rare instances, you get it through sexual relations and blood transfusions. The blood transfusions have pretty much been removed out of issue, but there still is a very slight risk there, but that's pretty much it. In most cases, we're seeing IV drug use.
Thank you. Okay, so let's, we can go ahead and move on to the open discussion. Anything anybody wants to bring up this month or talk about?
Any questions and for past discussions, follow-up or anything? As well?
No. Okay, that concludes new business, and we can move on to our reports, and begin with our health commissioner.
The only thing, again, Middletown Connect is moving forward. We have done some data walks and talks with Amanda area, and again, it's pretty interesting. The mayor may be able to report on this too. You know, sometimes when you live in a community where you're used to seeing certain things, you stop seeing those certain things. And so then, when you start talking about it, it brings it all up. So a lot of our first discussions were just listening. It was just a lot of, I mean, some people would call it complaining, but it wasn't complaining. It was just the despair more so. And another big thing, other than you know, we hear about the pollution, like the house covering of the soot and the cars and that kind of stuff. But the walkways of the schools, no sidewalks. If anybody would go down Oxford State Road, you can kind of see, it is, when you get back in the neighborhoods, they're beautiful. Some of them are, you know, really nice, just like any other neighborhood, but just that stretch, right, is this kind of sad, and just, to me, it just looks like a sad area. But anyway, the school part could be changed easily, I think easily, and so I think we are gonna maybe be able to address some of those changes, lighting, those kind of things. But I always tell people say, oh, people just need to clean up, they need to see. Sometimes it's just not that easy. People just kind of put their blinders on and come through there. So hopefully we will be able to do some things that'll help that. And it's a big cleanup coming throughout, I think it's April 20th. The city's doing this big cleanup trash bash thing, large, like air conditioned, like those free-on appliances, like air conditioned refrigerators and that kind of stuff. It'll be a big truck at the high school. But our data shows in this end of town that have difficulty with transportation may not have access to it. So Middletown Connect is going to get some trucks, some people with trucks to maybe go by and get things out that's been put outside so we can take it to the high school. So that's one of the ways that Middletown Connect kind of can hear the pleas of the community. Yeah, we have this, but we don't have a way to get it there, so we're gonna be doing those kind of things. But as we move on with beautifying that area and seeing what they really want in the area, we hope to come to consensus that everybody can work together to get it done. I'll give you another good example. Duke Energy wants to adopt a park, and they want to maybe adopt Damon Park. Damon Park is over there in the Amanda area. And so I think we have park monies, that they have a park plan that we can do things in our parks, but if they work together with Duke Energy, we can get more things done. So that's how we're trying to connect some of those things together. And often, if you just listen to them, just doing a few small things make a big difference. I guess that's what I'm saying. It kind of breaks your heart because they're not asking for a lot. one of the big things that, people complain about all the time is the nuisance, but they complain about crime, you guys, and they had a lot of crime. They have a lot of people that they know are doing drugs, the houses that they know have drug houses, and they just have no explanation that they can continue to do that, and so we're working on that too. I think they were saying a lot of it's due process and et cetera, or landlords or whatever, but they have, this one lady said that her husband goes to work and 3 o'clock in the morning, they knock on her door, she has small kids in the house, and she can say through her ring, you know, Emily's house is next door. Oh, I'm sorry, ma'am, because they're looking for Emily, the next door, because it's this known drug activity there, or something like that, so, you know, it's just that kind of things that kind of, bothers you. Last but not least, I think they have, it's an area where it's sheriff, it's county, it's city. And so that gets confusing. So sometimes when they call in, they'll say it's outside our jurisdiction. And so nobody kind of helps them. And so they don't know where the police or the security starts and stops as far as if you're Middletown City or if you're sheriff. And so maybe some simple things to know what service, who do you call for what services or whatever. So did you have anything?
Yeah, I'd love to add to that. Thank you so much. And I think with the trash bash that's coming up on the 20th, it's such a good idea for Middletown Connect. That was brilliant to have vehicles to help out, to transfer those items. And did we talk about this last time, that the city manager and court representative and our public works director, council member and I were at the Amanda Data Walk? And so those conversations were started, actually. City manager Paul Lally was speaking with a resident, and they've met, and they're starting to have those conversations about what we can do, because they have certain specific items that they'd love to be addressed. And so when Mr. Lally saw those items, he's like, oh, the city can do this and this and this, so many of these things, let's talk. And so that was just a really great evening and conversation to get things started, and that's all it took, that communication, that connection. Middletown Connect is vital for that.
And it was, they said they talked to other people. So you know, when you have the changeover, and they said, we feel like we just complained, or we just had conversations with a first group of people, now it's new people. So that consistency has to, you know, it's not really John Doe, it's the city manager. And so that communication has to continue regardless of who sits in the seat.
Right, and that's also part of the learning. It's like, oh, we do have to continually talk about these things, because life changes and people come and go, as you were saying, like we have new people in and people are gone, so we always have to keep these conversations going. So it's all a learning process, and Middletown Connect is doing a great job that way.
And the overall hope is Middletown Connect does not have a lot of money. We could go for mini grants and all that kind of stuff, although that's gonna move into my second point. We have a retreat coming up where Interact for Help, which is a large funding group in Cincinnati, has requested us to formulate some kind of package model that Middletown Connect started. And understand, we're gonna have this 2-day, like it's a day and a half retreat. We go there Friday night, and there is in Cincinnati, and then we have it all day Saturday. Trying to come together how we formulated this whole Middletown Connect, but truly it has been a grassroots effort that keeps morphing. So we're just listening to the community. So it's not like we're gonna go in there and do a survey, then we're gonna go in there, analyze the data, because we have to completely keep pivoting. And so, it's been fun, but sometimes we go in there ready to plant, you know, bulbs, and next thing you know, we're cutting down trees. I mean, because they don't want bulbs, they want the trees cut down. And so it's kind of fun, because they're all built on assumptions, because assumptions, you really think you know what people need or what their problem is, and it's completely different. So we're excited about that. It's been an eye-opener all the way around, so. But that's it, and then that's the only thing I wanted to tell you. I have the report in here, but we'll be going down to Cincinnati. I think it's a hotel called Hotel Summit or something down in Cincinnati. All of it's paid for by Interact for Health to try to get this.
Is that open to the public, or do you have to have tickets?
No, it's just, we're kind of like having a sleepover retreat, brainstorm.
Oh, it's retreat,
Are
okay,
you
yeah.
still doing anything at Central Connections?
Oh, that's a good question. That would have been the open discussion part. Okay, so, no, I'm just kidding. I'm just laughing. Well, yes and no, yes and no. The council tonight will thanks, Jeff. The council tonight should be getting, a report back on the RFPs, that they put out there for Central Connections. And I'm not doing anything other than, like assisting. We have a part-time person over there, Antoinette, so I'm just assisting her when she needs things, problem solving, that kind of thing. We're just opening and closing the doors right now for the seniors and letting their activity continue. But the city council will talk about how do they wanna move forward to what they want to do over there. A lot of people are still reaching out to Central Connections because they want to rent out the facility. I've talked to the city manager and said, I think we should move ahead with that. I think we should clean the building, because the building has not been thoroughly cleaned since we took over, right? We just kind of pushing dust over there. And start doing rentals, you know, just for a venue like you have at other places, because it can hold larger places, crowds. And you can have them have their own caterer in there and their whole, and you can start making some revenue off that while we're deciding, so. To be continued, it's all like, I think, in city manager's results and then council's hands.
But I don't know if it's gonna be spoken about tonight, it's not on the agenda.
I don't, so.
So I don't know if they're gonna we're gonna be speaking to that this evening.
sick.
I'll
Yeah.
find out.
Yeah,
I'll find out.
okay.
Yeah.
I didn't know I think the RFPs were in, and then they were gonna probably bring it to them, so, yeah. So it would be up to city council how they wanna move forward, like if they wanna continue with the cost as it is, if they wanna select one of the RFPs or not, put another RFP out or not, you know, that kind of thing. But in the meantime, I would love to have some rentals happening,
Mhm.
because people want the space, and it is a good space.
It's a beautiful space.
Mhm.
Is there, it looks like you have a state of mental health at Miami Hamilton coming up, is that correct?
A state of mental health is supposed to be at Miami Hamilton.
You know what date, time?
It's coming. I don't know. Scott Rasmus,
Mhm.
Dr. Rasmus said that the Channel 12 or whatever have reached out to him. They were
Okay.
looking for a venue. I had said Middletown, but it looks like they're gonna maybe go to Hamilton. And he'll let us know
Okay.
when that will be, but there's no date on it yet.
Okay, great, I'd love to have an update on that.
I know, that would be interesting.
Yeah. Okay. Anything else from the health commissioner?
That's all
All
I
right,
have.
well, thank you so much. Next item on the agenda under reports is from our medical director.
All right, thank you. So reportable illnesses, we were gonna mention the hepatitis. There were 6 hepatitis C cases, 1 hepatitis B. Those 2 are both usually IV drug related, and 1 hepatitis A, which is usually foodborne related. So even though they're all hepatitises, there's different causes and reasons for those. We did have 2 syphilis and 1 HIV, again, all likely tying into the opioid issues that are ongoing. We did have 1 mumps, 1 Lyme disease. We had 4 gonorrhea, 23 chlamydia, and another one that you see pop up and down on occasion is CPO, which is carbapenemase producing organism, a bacteria called Klebsiella. Carbapenem is kind of considered one of our last resort antibiotics, and when all else fails, and now there are bacteria kind of coming up with resistance to that. So that's definitely an eye catcher in the medical community, again, across the United States, but usually we've had 1 here, 1 there. This is the first time that I recall we've had 2 in 1 month. So it is something everybody needs to kind of keep an eye on, and particularly in our field of being careful with antibiotics, and what do you do when something becomes resistant to everything? Becomes a problem. And that is my report.
Who would speak to this, is that him, or is that somebody else?
Oh, that's a needle exchange? It's just, it could be
Anybody?
anybody. That's Butler County's report.
Okay, thank you, Dr. Genowine. And next on the agenda, I'm sorry, is there any discussion about anything, questions?
And I do think, just tying into that little comment, was a lot of times the needle exchange has a lot to do with these numbers, because it all depends on who comes in, who gets tested, and then is the hepatitis B and the HIV and the syphilis all in one person. So a lot of those numbers come from some of those programs that then eventually trickle back, and may not have really been something this month, but we're just getting a report.
Got you.
Right.
Yeah,
And
go
if we see an increase in those numbers, remember, since our needle exchange location is closed,
Mhm.
we, Butler County is watching really closely the epidemiologists to see if we start seeing those infectious diseases increase.
And was it last year, we saw quite an increase in HIV? Or was it
The year before, year before.
22.
Year before.
And that has, you know, lack of a better term, I guess, settled down
It
to
has.
some degree, but.
Absolutely.
So I look at some of these numbers from the syringe exchange, and sometimes it looks like, oh, we have 100%, like, not, like, some people have like high return rates and
Right.
things like that, and I was kind of wondering, like, looking at Warren County, and they have like a 97.7% return rate, and that's fantastic. I was just wondering, what do they do? How does that rate, how is that so high for them? It was just a question, like, what could we do better or differently, or that kind of discussion.
And you know, those are not Warren County as much as Warren County clients, right?
Okay.
Those are the clients, those return rates is when a client, visits the needle exchange, and they're looking at percentage-wise of who's bringing back needles, right? And so, and if they're from Warren County, that's it. Warren County doesn't have a needle exchange.
Okay, gotcha, just if they have to, so it's just interesting, like, what,
Why
I was
would
just,
they
I
have-
was looking at the numbers and like, oh, that's interesting, okay.
Well, when most of these started, particularly ours when it started, you see doing it, it was mandatory.
Right.
It was a 1-for-1.
Right.
So if you wanted a new needle, you had to bring back a new
Right.
needle. With the idea being of kind of cleaning up your community
Right.
and getting those, rather than dropping it in the alley, bringing it back, getting a new needle. Most of them have gone away from that for some reason.
Yeah, why? That sounds, did it work pretty well, it sounds like?
What CDC said it's not, it's not really, what do you call it, if people are users, for you to just give 1-for-1 and you know they're a user, and if they don't bring any needles back, it doesn't mean they're not gonna share or whatever, so they always, I think need-based was what CDC really wanted us to practice.
Gotcha.
Versus a 1-for-1. 1-for-1 makes a lot of sense, and that shows the responsibility, et cetera. But if you know a person has HIV, or if you know a person has a strong, and that 1-for-1 is good if you are at needle exchanges every day.
Right.
But ours was once a week. So that means that person would have to wait a whole week to get another needle. In Cincinnati, they have them all over the place. You know, you could really go, and in Dayton, they have it all over the place. And in Dayton, they have them open 7 days a week, or maybe 5 days a week. It's not one time a week. So it was some of that discussion.
All right.
But I think 1-for-1 is really good for cleaning up the community, because we did see a big, drastic change. We found hardly any in the parks at all. In neighborhoods, we were seeing a very clean community when we first started.
Okay, so it sounds like if you have a needle exchange, being open every day helps, and then a
Yes.
1-for-1, and that, those two things together can work.
Yeah, some people don't wanna hold on to those needles for a whole week, because if they get busted, or if they get in trouble, they get, so, yeah.
Right,
So they hide it in your bushes. Then- Well, just tell you. I'll just tell you what they tell me.
All right, so any more discussion, questions? We will move on to our next item on the agenda, which is from our Director of Nursing.
Okay, so we all survived the eclipse. All the planning was not for naught. It was, if you didn't get a chance to view it, it really was a fun event. And, you know, it'd be, some of us won't be around for the next one, even if we wanna travel to it, so, so just to let you know, the next one that comes through, I think, is in 2044.
44?
It's 22 years, so what's this, 49?
Yeah, and so
Six.
go to Florida, cause almost the entire state of Florida is gonna be in totality.
Wow.
Otherwise, it's going across the entire country, but Florida is almost 100% in totality, so plan your vacations accordingly.
Is it always the same time? Is it always like April?
I did not
I
look
was
at the
wondering,
month.
do we know that? Has anybody heard that, does that happen? I was just curious.
Yeah, I didn't pay that close attention, I just trying to, am I gonna be alive for the next
Oh,
one?
yeah.
Will I be in retirement down in Florida?
We'll be up in the, we'll be a celestial.
We'll be
being.
watching it from above.
We'll be a celestial being.
Or Woodside.
So that was a good exercise in planning when we start looking at our emergency preparedness. So I enjoyed that part of it. We thankfully are coming out of the measles outbreaks that we were having in the state and across the country. It seems to have started to calm down. But as a result, there is going to be a meeting here in April with medical providers, hospital providers, live and virtual, to discuss how measles should be handled on an emergency basis to ensure the safety of medical staff, other people who potentially could be sitting in waiting rooms with folks who potentially have measles, and who they're supposed to report to and how that process is supposed to go. And local health department's been invited to be there in attendance as well, because we are the first people that they're supposed to contact. And a lot of providers don't know that, because a lot of providers don't, thankfully, have to deal with Class A reportable diseases very often. So, and especially if it's in the evenings, weekends, and hospital IPs aren't on staff, they don't know the protocols. So it's a good refresher for them. And measles just happens to be the topic of discussion. We're talking about the CPOs. In our case, we have they're in our nursing facilities right now. We have a couple nursing facilities that we're working with, and it's a bacteria called Acinetobacter baumannii. So we are continually screening to make sure that it's not being spread throughout the facilities. Some of these newer cases, they're coming into these facilities with it, and then that just kind of triggers us to then monitor the facility. So those are ongoing. Hopefully before summer we'll be done with screenings, as long as they don't continue to get new cases. Aside from that, I think we're good.
Thank you. Any questions or discussion? Hearing none, we'll move on to our last report from our environmental health director.
We have approved and licensed 4 new facilities. One being 101 Sports Bar, which is Zulu Bar. The new owners are not English speaking, they're totally Spanish speaking. So normally we would struggle through the whole licensing process. However, Stephanie was able to go out with us and do a lot of translating, so that was really, really nice. Of course, we have Brenda's Cafe downstairs. We licensed Waffle House and another mobile called Jerky Go. We also have plans for 2 new mobiles as well, so we have a total of like 22 mobiles now, and they're continually coming. So I think every season we always see an influx of different businesses, and I think right now mobiles and tattoos facilities are really on the rise right now. I think we have about 11 11 to 12 tattoo body art facilities in the city, which includes permanent makeup type of facilities.
And still would like to be a part of some type of discussion of what kind of behavior we want with our food trucks.
Mm-hmm.
And we are not still a part of that. And, or do we have one? So I'll say this again loud, maybe we can hear it if someone watches this. If they're ours, we inspect them and we can control the way they operate. If they are someone else's, Cincinnati, Butler County, Hamilton, we can't control them. They can come into our city and they can sell food, and we can't control how they operate. And so we need to kind of have some kind of, I'm making this up because I'm not a sanitarian, but I was telling Carla, if it's some kind of way that when they are allowed to come in on anybody's property or whatever, it's rules to operate a food truck in Middletown. You have your license, but we want to make sure, just list, that you dispose of your waste properly. We want to make sure, that kind of stuff. Because sometimes it doesn't happen, and for us to go out there upon complaints takes up time and effort from our department that we have no revenue from, we get no revenue from, and we can't do anything, if.
Is that a state, these are state laws, not local?
Not local, so what it would take is a local ordinance or a local protocol or a local, you see what I mean, something like that, to say that, you know, to say, didn't we have, we kind of played with a food truck kind of policy or ordinance, like where they could come into the town. And all they have to put on there, when you come into Middletown, if you're not licensed by the City of Middletown Health Department, we would request you to follow these rules. They should know it, but at least if we say it, then we may have a little more teeth in it, because they're gonna start we see them
Well,
start
does that
popping
have
up.
to go through the city council, or does it have
Yep.
to go
It
through?
has to go through city council, it should be like, you know, city manager or zoning or whoever is allowed, setting these, or what is it, legal maybe setting the policy, and then it should go. And it's just, and if we're at the table, we can at least tell them what we see when we go out there to these out-of-town trucks, and so they can maybe put some of that in there.
So what's going on? Nothing?
We're actually talking about it again soon. I just spoke with the city manager, we're gonna be talking about that today, actually.
Okay, good.
Not necessarily at the meeting, he and I.
Right,
Yeah.
oh, yeah, oh, you guys,
Yeah,
okay.
he and I are meeting, but.
So
um,
just, and
but
you
that
see
should be
why the,
coming.
yeah, and you see why the issues, just have us at
Yeah.
the table, so we could say,
Mhm.
you know, this might happen, that, cause we see all the stuff that sometimes they keep their stuff off the truck in a place that's not a place that they should keep their food.
Well, I was just out with some people, just, you know, from the, and it was funny, the one person just mentioned that, and they said, you know, there's no rules, or, you know, why are they able to come in and do that and everything, and, I mean, not that it had nothing being on the health committee, you know, they were just talking, it was something that came up, and I was kinda surprised that, you know, somebody that wasn't in the food business or anything happened to bring it up about, well, you know,
What
there's
they gonna
no,
do?
no
We can-
rules about
We
anything.
can
and-
license the trucks, but we can't take action on their license. We can only take action on the licenses that we issue, so.
There are
that's
some
usually-
rules from
yeah.
the state, and there are some rules, it's
There are
just, the rules are not.
So it's a Wild West, it's just whatever you wanna do, just,
And that's what council's gonna be looking at. We had something on the books, it kind of got tabled, but we're bringing it back up.
just curious.
It's a timely issue and an important issue.
I guess.
Well, vape shops, tattoos, and now, just pop-up restaurants. That's-
All of our food licenses have paid except one facility, and that facility is currently not open, so I'm not sure, it's Bingo Block, which I'm not sure that they, well, I think they got broken into or something, yeah. So I'm not sure that they're gonna reopen, so, but we finally got all the licenses, all the, payments in for that. Did you wanna talk about that criminal prosecution? No, okay.
Look at me going,
I am working with, Chet Schuler, he's, works for the city and the GIS, works with he's the GIS administrator. We're working on the whole, septic, list. Come, next year, we'll start inspecting the septics that are in the city, so we're just trying to make sure we have our list update and accurate. As always, we've actually found, about 12 more septics. It's always gonna be an ongoing process. I'm sure there's septics throughout the city here and there, but we've identified 12 additional ones. 7 of those are on Union Road, which we weren't aware of. Union Road was annexed in the city in 93 or 7, I can't remember exactly, in the 90s. I'll just say they were annexed in the city in the 90s. How we identified some of the septics were if you were paying for water, and then we could determine whether you were on sewer or not, but I believe that those homes are on wells, so they kinda got unidentified. So we got like 7 homes on Union, and a couple throughout, I think 2 more on Amanda, and I can't remember what the other one was, so. Actually one on Audubon too, which is out off of Cincinnati Dayton Road, so we kind of find septics here and there. So, he's working with us on that, as well, so, we'll start that process really, towards the summer, late summer, sending out notices to pay for your, permit, septic permit. And start doing inspections in 2025. And like I said, just continue on working with Brandy and Sarah. Like I said, both Sarah and Brandy are still, training in certain areas. We started working mostly on our schools, in March, cause they'll be getting out. We start inspecting our school buildings, so our food service is down a little as far as our inspections. And also, Sarah has been, working on plan reviews, cause we've been getting a lot of plans for mobiles and other things, other food service operations, so the inspections will be down a little bit as we continue to train in all those areas. And we also sent out a notice of violation to City Tavern for smoking complaint. They'll eventually get a warning, and then after warning, the fines will start accumulating for smoking.
What are the fines?
What's $1,200 for, what is that?
Which one?
Billy Key? I don't know where that is.
Oh, yeah, he had unpaid fines.
Has he paid them?
25.
No.
Well, then how do you keep them open?
The state handles the fines, so. We don't handle
It's
the
like
fines.
everything else, nothing gets done, you have all these, they have
Yeah.
$1,200 and they're still, I mean,
Yeah,
what's the big deal? You don't have to pay it ever.
Yeah,
Does the state ever do anything with them?
they do eventually, once they get, I don't know if they're gonna do anything about $1,200, but
They have a.
they get so high, they do.
They come in, they'll have state people come in, they used to do that,
They'll
have
take
the
them to
state people
court.
come in.
Yep, yep.
What was it, the big people, like the arms and the FTA, whatever,
Mhm.
federal tobacco and alcohol and people. They'll come down.
With that fine of $1,200, is that something that it's just an amount that triggers the state coming, or can we make phone calls, or can we ask them to enforce, or how's that work?
I will have to check, I'm not sure how that usually works, cause we have like one facility that had, they end up going out of business. Some, we've had one that go out of business, I would have to check with them to see how they proceed to
I mean, it might be
to
nice
get
to
that,
know.
yeah.
To see if it's an amount that triggers.
Yeah, yeah, I'll check on that.
Yeah, thank you. And I was curious also, so what does a smoking complaint entail? Is it just someone is smoking inside, or is there anything else?
Yeah, it could be infiltration of smoke, yeah,
Oh,
so,
gotcha.
yeah. So it
And
could be
it's reported.
infiltrating, it could be signs, not having signs, posted, and smoking inside, ashtrays present, any type of ashtray. Which means if you're using a can, that's considered an ashtray. So,
It's
yeah.
triggered by the 800 number. Someone
Yes.
has to call the 800 number, so it's triggered, that 800 number goes to the state.
What's the 800 number?
Somebody smoking in this establishment
No, I
number.
meant, do you know?
Oh, what the number is? Do you know what the 800
I don't
number
know
is?
it off
That's
my
on-
head,
okay.
but,
We can get it to
It's
you.
on, all the number are on the signs, so
Gotcha.
people can.
And then the state
Sign.
notifies us.
Okay.
Yeah, so that's why it's anonymous kind of, and the
Mhm.
state notifies us, and then we have to go out, and the state likes us to go out during kind of somewhere around the time of the complaint.
Okay.
So they really, if it was an 8 o'clock complaint, they really would like us to kind of try to go out around that time so we can kind of make sure we catch that person that does it. And then that's when you find out if it's, ashtrays are out, or, that's when we decide that.
How much is you said there's a warning and then the fines start, is that always the same amount?
No, it
Increase.
increases, starts like 100, 500, and 1,000, and we could double the fines if we see that they're, intentional or,
Gotcha.
yeah.
Okay, thank you. Anything else for environmental?
Nope, that's it.
Any other questions or comments? Oh, thank you. Oh, here's the number. Thank you very much. So the number is 1-866-559 Ohio, which is 1-866-559-6446 for the no smoking violations. Thank you. All right, so that concludes our reports for the day. And the next item on the agenda is adjournment. So this, we are going to go ahead and adjourn the meeting of the Board of Health for today at 8:29 a.m. And the next Board of Health meeting is scheduled for May 14th, 2024 at 7:30 a.m. here in this room. Thank you.
Thank you so much.